Hello, my name is Alicia Werkheiser, and I'm going to be talking with you today about the barcode medication administration and its effectiveness in preventing errors. The problem in healthcare facilities, medication errors are occurring every day, and the nurses need to be aware of this issue and look for proper ways to prevent these errors from occurring. So we need to be more knowledgeable on the technology that's being incorporated in the hospital facilities. But the solution, though, to medication errors, the barcode medication administration technology was implied a few years back. It helps to limit the manual paperwork that's included in the nurse workday or even the physician's workday. It also helps to provide accurate revised medication orders. This was the topic of interest due to the fact that it is a new endeavor that any nurse who is entering into the healthcare facility should be aware of this technology to make sure they're providing the best care for the patients. It also can improve the world of healthcare in general. This technology is very significant to the nursing practice because it helps to ensure safety for the patients. It helps to provide up-to-date information, which is given through the electronic pharmacopoeia, showing drug pictures, the drug interactions, side effects, to make sure that the nurses have the correct medication and dosages available for the patients they are providing care for. This technology also helps to provide a great line of communication between the nurses, physicians, and pharmacists due to the different facilities that are included and the different shifts throughout the day. It is also great in the home care settings because a lot of elderly patients are taken care of away from the hospital, so it's very proper to have all their information, their background, drug interactions available so they are getting the best care and having no issues in their home setting. The research question is a barcode system an effective method for preventing medication errors. This helps to guide us through the search process, which all the databases that I will be speaking about are full text linked, also peer-reviewed, English language, research articles. The date was basically limited to 2004-2012 for all of these databases included. The barcode medication administration was the key word. And for the Science Direct, though, the year was limited just to 2012 because for the 2004-2012, there were too many results, so just to help to narrow down the options. The article then that was chosen for the research critique is Impact of Barcode Medication Administration on Nursing Activity Patterns and Usage Experience in Taiwan. The authors are Huang and Li. They are both RNs in this study. In the beginning of this journal article, there were no previous studies or theories mentioned to help back up the start of this study. So basically the problem behind that these researchers focused on was the nursing activities and their use of the barcode technology within their day, if it was very effective enough to provide safety for the patients. The purpose of the study was to observe the nurses during the use of the technology, which they were observed in 3-minute intervals from a female clinical observer. The design of the study is descriptive. The framework is based off of the nursing activities, the time consumed during these activities like indirect care or direct care, and the barcode technology that's included during the activities. Is the time being reduced for the activities? No distinct variables were used to control the measurements, and the study was completed in a Taiwan medical center. A 6-unit hospital was chosen for this study because it already implemented the barcode technology, so nobody needed to be trained for this technology, so there were no interferences in that case. The 3 units were chosen to use the barcode medication, and the other 3 units were chosen to use manual paper. There were no age or experience requirements in the background of these specific groups. But 13 to 18 nurses were assigned per unit depending on the shifts between morning, evening, or night. There was also qualitative interviews completed to help the researchers get a better understanding in the nurse's personal view, satisfaction of the technology. Once the results were completed, it was entered into a chi-square analysis. The observations were all shown by percentages of how much time was spent observing the nurses doing these specific activities in their day. The medicine-related activities showed that 17.4% for the barcode medication group and 25.0% for the paper group. So it showed that the paper group spent more time doing the medicine-related activities. Indirect care versus direct care. Indirect care had a higher percentage rate of time spent versus direct care, where now another study was mentioned, and the previous study that was completed at another medical center in an intensive care unit, direct care had a higher percentage rate of time consumed. The limitations for this specific study done in Taiwan, it was only done in one medical center, so more centers need to be observed to get a better results, more reliable results on the nurse activity, maybe the knowledge, their use of technology, all in all. More units need to be observed, like emergency rooms. Instead of just one specific, this was a neurological unit, so it needs to expand more to get a better result. Also, nurses need to have a comprehensive input, a yearly records of their use of the technology, what they're doing, any complications that occur, to give better information for the studies that will be performed. This study, though, does show that the barcode system is useful to help prevent medication errors, but it more or less focused on the workload of the nurses. But that, all in all, helps to provide better concentration for the nurses to provide better medication outcomes. The study also helps to show that we need to enforce stronger research practices for better medication outcomes. Again, more studies need to be observed to provide better results, to show that the barcode medication administration is effective in preventing medication errors. We should try to rely on other health organizations around the world to see if they are doing better interventions and having better outcomes for the patients, because safety is the top priority, and that is what we are focusing on. The references are Burns and Grove, Hang and Lee, and I thank you for your time.